The chipmunk look, while cute in cartoons, is not exactly welcomed by patients having their wisdom teeth removed. While most patients expect to have some level of swelling after surgery, the fact is it can be completely prevented. Using a unique non-invasive technique, post-operative swelling can be minimized or even completely avoided, even in patients with impacted wisdom teeth. So what is exactly a non-invasive technique in third molar surgery, and how is it done? And can it be done in every patient? In this episode, I will share with you a unique oral surgical approach for removal of wisdom teeth and how it can help most patients recover faster with little or no swelling, less discomfort, and minimal complications. I'm Dr. Ryan Kazemi, and welcome to Hints and Tips in Dentistry. One of the most common oral surgical procedures is removal of wisdom teeth, which is often done between the ages of 16 to 18. Now, wisdom teeth are recommended for extraction because they are frequent causes of localized inflammation, infection, decay, and gum disease. And also they have high risk of potential irreversible damage to adjacent teeth. So when it comes to wisdom teeth removal, there are primarily four chief patient concerns, often expressed. These include swelling postoperatively, pain or discomfort, chances of infection, and also a very frequently asked topic on dry socket. Now, we talk about these complications as well as techniques on how to remove wisdom teeth in our ebook called The Wise Guide to Wisdom Teeth Extractions, which is available for a free download on our website. We discuss not only the rationale for wisdom teeth removal as well as techniques, anesthesia options, both pre-operative and post-operative experiences, and a lot of information on recovery. So I encourage you to download it to become more familiar with this procedure. Now, in order to decrease the chances of swelling, pain, infection, and dry socket, it's important that we choose a non or minimally invasive surgical technique. This allows us to have less insult to the tissues and less surgery involving the gum tissue and the bone surrounding the wisdom teeth, hence decreasing the chances of these potential effects. So when we look at non or minimally invasive surgical techniques, it usually includes using micro incisions for access, using the tunnel technique to extract the teeth rather than a reflection of the gum tissue and a wide window, using very, very small areas with the tunnel technique, no or minimal gum tissue flap, practically no or minimal removal of bone around the wisdom teeth, and also a very atraumatic tooth removal technique to dislodge the tooth easily. Now, to show you how this process works, we have an impacted third molar here, and the use of a very, very small micro incision, just enough to expose a tooth that is underneath the gum tissue, minimal gum elevation, just a very small access to expose the area, practically no bone removal or very minimal if necessary to expose the tooth, and a very careful, gentle dislodging or elevation of the tooth out of the socket, and just a closure with a small suture. These are all techniques to respect the tissue, both soft tissue and bone, and this all helps to minimize the side effects that we talked about earlier. So here's my tip on how to avoid and minimize swelling, as well as other problems we discussed, post-operative pain, infection, as well as dry sockets after wisdom teeth extraction. The first is to use non-invasive surgical techniques. This includes micro incisions for tooth access, no or minimal gum tissue reflection, no or minimal bone removal, and using tunnel techniques for tooth access as minimal as possible, and using atraumatic techniques and gentle elevation to remove the tooth out. And I think these procedures are most well known to oral surgeons, who are the specialists who provide these procedures on day in, day out. So when it comes to using non-invasive techniques, they will be probably the best specialists to help you with this procedure. So just to summarize, the outcome and the result of using these non-invasive techniques is no or minimal swelling afterward. Patients recover faster, they get back on their feet quite quicker. There's quite a bit of diminished pain after the procedure. Post-operative pain can be managed quite effectively using over-the-counter medications and avoid any unnecessary narcotics in most patients. There is minimal risk of infection. With conservative techniques and approaches, there's less chance of infection, as well as less chance of dry socket, which is really a wound complication that can occur with overly aggressive surgical procedures. So all of these things can be minimized using this non-invasive technique. So, using minimally invasive surgical techniques, it is very much possible to have wisdom teeth removed with little or no post-operative swelling, pain, and also decreased risk of infection and dry socket, as well as much faster recovery for patients. This technique is more difficult to perform and does require more skills by the treating surgeon, but it is the most effective and predictable way to improve your experience and the overall recovery. I'm Dr. Ryan Kazemi. See you again soon on our next Hints and Tips in Dentistry.